Mr. President, I rise today in opposition to the budget resolution that the Senate will vote on later this week. We are nearly halfway through the fiscal year, and Republicans have offered this budget resolution not to set the path forward on spending for the year, but to give them the ability to repeal the Affordable Care Act through the budget process, requiring less support than is needed under regular order. This budget is nothing more than a sham being used to take away health insurance from more than 20 million Americans. What's worse is that my Republican colleagues intend to do so without any plan in place to mitigate the impact and protect the people who will be harmed. The uninsured rate is at its lowest point in recent history. Since implementation of the ACA in my home state of Rhode Island, the uninsured rate has fallen from nearly 12% to under 4.5%. In real terms, that means that over 100,000 people in Rhode Island have gained coverage because of the ACA. That's about 10% of my population. Over 30,000 middle-income Rhode Islanders get tax credits averaging $250 each month to help them afford coverage on the state's health insurance marketplace. We cannot go back to a system that allows private insurers to deny coverage for pre-existing conditions or charge more to those who need insurance the most. In fact, the Republican plan to repeal the ACA would mean that nearly 500,000 Rhode Islanders with pre-existing conditions, nearly half of the state's population, will be denied coverage or charged more. Again, as Senator Murray describes so eloquently, the case of the young man who needs years of expensive treatment. But if pre-existing conditions are once again possible, if that young man is dropped from his parents' plan at 21, both of those factors would probably deny him the coverage that he enjoys today. And that's not what we want to do. I hope it's not what we want to do. In my state, there are over 160,000 Rhode Islanders with diabetes, over 112,000 with asthma, and nearly 63,000 cancer survivors who would be forced to pay more for coverage. These are huge numbers in my state, roughly about 1 million people in population. They have these conditions, and insurance companies, as they did in the past, could simply said, we won't cover you, or by the way, you'll be saying 2, 3, 5, 10 times as much for the coverage we extend to someone else. And we've also been able to improve through this ACA coverage for those who are getting their care through their employer. Before the ACA, insurance plans, including employer-sponsored health coverage, could impose annual or lifetime limits on coverage, meaning coverage could end just when it was most needed. You could have a job. You could have insurance at your job. But if you had a serious condition, when you reach that limit, that's it. No more responsibility by the company. And that's exactly the time you need the help, because you've already either exhausted some of your own resources, or you're in a position, you've been sick for so long, your ability to go back in the workplace is practically non-existent. The ACA prohibits these limits, along with ensuring free preventive care and coverage of dependents up to age 26, ensuring real coverage to nearly 600,000 workers in Rhode Island with employer coverage. There is a perception out there that ACA doesn't apply to employer coverage, that has no effect, that if it's repealed, that's fine because I get my health insurance from my employer. That's not the case. The impact will be there, and it could be, for many people, devastating. Additionally, the ACA strengthened the rate review processes to help control premiums. Prior to the ACA, double-digit increases were always the norm. When I served in the House in my first years in the Senate, invariably, when trade associations came to visit me, the first or second issue on the list was our insurance coverage just went up 20%. We can't afford it any longer. We're dropping coverage. Or we're telling our workers, you want a raise or you want coverage. You can't get both. Well, we've got to do more to keep premiums under control and bring down costs, but there's been an improvement under the ACA in my state and in many other places. In 2 of the last 3 years, premiums actually went down from the previous year in Rhode Island. And during open enrollment for 2017, Rhode Islanders saw decreases of as much as 5% in their premiums. In fact, due to the ACA, Consumers in Rhode Island have saved nearly $220 million since 2012, according to the state resources. So, Mr. President, this program has done something that we were feverishly trying to do, which was to somehow bring costs under control, reduce them if we could, but certainly eliminate that double-digit growth that every year, every employer group was coming in and saying, we can't afford this. We want to cover our workers, but we can't. And we're giving them that choice. Or we have to sadly say we can't give insurance anymore. Now, repeal of the ACA would end all of these consumer protections and put insurance companies back in charge. One other thing we've done in the ACA is we actually require that a significant amount of the premium is used for health care, not overhead. We've actually built into the law, if you're going to charge a premium, it better go to help people get health care, not just to boost your profits, dividends, or anything else. That is another factor that's influencing, I think, positively this rate structure and this rate and premium structure. And then, of course, will be a huge economic impact of ACA repeal. For years, I've heard my Republican colleagues very sincerely, very, very adamantly declare that the ACA is a job killer, that it's going to destroy millions of jobs. That was one of the refrains that echoed throughout this chamber as we were debating the ACA and for months and years afterwards. But what has happened? We have had an unprecedented 75 consecutive months of job growth, something we haven't seen since 1939. Repeal of the ACA would wreak havoc on this process. Premiums for everyone, not just those in the individual market, will skyrocket. Large businesses will see their health care costs go up, which means workers will forego pay increases as their employers struggle to simply maintain health care coverage, or they'll drop the coverage entirely. We've come a long way since the economic downturn in 2008. We've much more work to do to keep things moving in the right direction. But one of the worst things we could do for our economy is to repeal the ACA. Rhode Island, in another aspect of this, stands to lose over $7 billion in federal funding over the next 10 years with repeal. And again, that is a staggering number for my state, $7 billion. That would be devastating for the state because they would have to step up as best they could. And frankly, they don't have the kind of resources to replace that loss. It would have an effect on the hospitals and other healthcare providers. Hospitals in Rhode Island would stand to lose nearly $2 billion in funding on top of the added expenses of emergency room care of the newly uninsured. Because we remember the old model of health care. The old model was you didn't have insurance, you went to the emergency room. And those emergency rooms were crowded with people. They were much more expensive to treat because they were there without any previous experience with the physicians, without health records in many cases. They had to do diagnostic tests that would have been available, that are now available at the healthcare facility because they have insurance. All of that would come undone. It would have huge impact on the economy. The largest employer in the state of Rhode Island, it's a hospital system. And I don't think we're alone. If you go out into rural parts of the United States, in many cases, the biggest employer in the county or several counties is the healthcare. It's the hospital. It's the hospital system. And when they no longer can make their books balance, they're going to have to start closing down operations, laying people off. That's what's going to happen. And this is not far-fetched because we've seen it before. We've seen struggling hospitals, struggling under emergency room uncompensated care. We've seen all of these things happen before. And repealing the ACA would lead to a combination of all these factors, skyrocketing premiums, the loss of federal funding for health care in states, which should have a ripple effect throughout the economy. If Rhode Island or any other state has to step in and partially make up for the loss of Medicaid funds or any other aspect of this program, where are they taking it from? Education, infrastructure, public safety. They'll suffer. Ultimately, it's the jobs. the jobs of the people in my state and the jobs of people across the nation. So there are things we can do to strengthen ACA. Senator Murray was very clear about attempts that we have made. She has been one of the great leaders in this effort to make improvements. We have been working on and improving Medicare since 1965, and we still have some work to do. But that was a different program. That was a program that was a bipartisan program, one that was embraced and developed and supported. In fact, one of the ironies today is some of the staunchest supporters and protectors of Medicare are Republicans, as well as Democrats. But that was a program that took several decades to work through, and we're still working through issues with respect to Medicare. And we're prepared to do that with the Affordable Care Act in a principled, thoughtful, practical, pragmatic way. Not to score points, political points, but to make it a system that's more affordable, more effective, that gives more American families a chance. And you don't, frankly, have much of a chance for good education, a good job, a secure retirement when your health is in jeopardy and your finances are equally in jeopardy. At this point, the Republicans have offered no plan to replace the ACA. And it's a tough task. I served on the Health Committee as we were drafting the ACA, and we spent over a year on this law. We spent countless moments reaching out to our colleagues on the Republican side to say, can we make this better? What improvements, et cetera? We had numerous votes in minutes. It's tough work. And to suggest that we can just repeal this and something will magically appear, I don't think that's particularly logical, obvious, or will happen. And there's been 7 years since the passage of this bill, roughly, that the Republicans have had a chance to prepare a detailed plan to replace aspects of ACA or to replace it at all. I don't think that plan is out there. It's certainly not being communicated. We have to ensure, and Senator Murray was very effective in making this point, that we can improve ACA, not demolish it. That if we get into a legislative process, we produce a better outcome for the American people, not an outcome of denial of health care and financial uncertainty and perhaps even financial ruin. So we have to get to work, and I think we're prepared to do this, but in the context of something pragmatic and productive for the benefit of the American people. Now let me switch gears just for a moment and talk about Medicare and Medicaid. Because when people talk about Medicare and Medicaid, they usually don't make an association between ACA. They think that's something else. I can recall being at a public discussion in August of 2010 when we were discussing ACA before it became law, and someone came up and was very critical of the program because they didn't want publicly funded insurance of any way, shape, or form. And I asked, where do you get your health care? Well, I have a private, where do you get your health care? I'm on Medicare, which is, as I recall, a single-payer national system of health care funded entirely by the government, with some co-pays by participants. Medicare and Medicaid are affected in a significant way by ACA. We made historic improvements to these programs, enhancing benefits. Indeed, we added 9 years of solvency to the Medicare Trust Fund. One of the great issues that reverberates throughout this chamber is we have to control entitlements. We have to prepare for the future. We have to make sure that these social programs like Medicare and Social Security and Medicaid and others are solved. We added years of solvency to the program through the ACA. If it's repealed, subtract 9 years of solvency from the Medicare Trust Fund. Tell seniors, tell people who are in their 50s who are getting ready to enjoy the benefits here, sorry, just take 9 years off your expected Medicare benefits, or at least a portion of those benefits. The ACA made a number of other improvements. They closed and are closing the donut hole for prescriptions. They've eliminated cost sharing for preventive services, for cancer screenings, for example, for Medicare recipients. Over 15,000 Rhode Islanders saved $14 million on drugs in 2015. That's an average of $912 per beneficiary, Medicare beneficiaries, because of what we did with respect to donut hole. And in the same year, over 92,000 Rhode Islanders, again, huge numbers in my state, took advantage of free preventive services, representing over 76% of the beneficiaries. 76% of the Medicare beneficiaries in my state took advantage of free services. Otherwise, they'd pay out of their pocket, and frankly, many seniors don't have those resources to pay out of their pocket. And repealing the ACA means these benefits go away, and it shortens the trust fund by about a decade. Repeal would also mean cutting $207 million in federal funding to help pay for health coverage for low-income adults, children, seniors, and people with disabilities through the Medicaid program. The ACA expanded eligibility and streamlined enrollment, made it easier for the most vulnerable to access quality health care coverage. As a result, approximately 70,000 Rhode Islanders were able to access coverage for the first time through Medicaid. Their previous source of health care, most times the emergency room, if they could get there. Now, I want to point out a couple of things about Medicaid. Medicaid has been a program for our senior citizens that happens to also help struggling Americans. Seniors make up a small percentage of the Medicaid population, but account for approximately half of Medicaid spending nationwide. Nearly 60% of nursing home residents are covered by Medicaid. Think about that. 60% of all nursing home residents need Medicaid. The next time you hear someone casually suggest drastic cuts and changes to Medicaid, think about that. Those cuts will work their way back to nursing homes throughout your state. And those families of those seniors, they're not all people who've been poor on the margins all their lives. They're our neighbors, and they will feel it. In Rhode Island, over 30,000 seniors access health care coverage through Medicaid. And my colleagues across the aisle want to make drastic cuts to Medicaid. Make no mistakes. Cuts to Medicaid means cuts to nursing home services for seniors, and return to pre-Medicaid times when the elderly had few options on. In the 1950s and 1960s, before Medicare and Medicaid, your grandmother or grandfather was in your living room in a hospital bed being taken care of by typically your mother. That's the way you grew up back in the 50s and 60s in most middle-income neighborhoods. That's at least my experience. And if you want to go back, that's what would happen in some respects if we repealed it. Now, if the Republicans want to come and work with us, we're ready, and more than ready. But we can't stand by and allow them to do the damage they propose, to take away coverage from 20 million Americans, cut benefits for seniors. That's not the right direction for America and for our country. And with that, Mr. President, I would yield the floor.